We're joined now by Dr. Simone Wilds, an infectious disease specialist. Dr. Wilds, thanks for being with us this afternoon.
Thank you.
So the COVID-19 pandemic globally is somewhat stirring fear among the public of the unknown. It is a constant fluid situation from state to state, country to country. What was just announced this afternoon by President Donald Trump is that we are in a national emergency. From your standpoint as an infectious disease specialist, you've been practicing for the past 23 years. What could you tell us about COVID-19 and its impact on the public?
So COVID-19 has caught all of us a bit off guard. However, I just want to reassure everyone that the medical professionals are really working very hard to make sure that we get this under control. We're trying to take care of the sickest patients. Also, we are trying to make sure that those that need to be tested will get tested. We're encouraging those that are not as severe to stay home, not come to the hospital, just be in constant communication with your doctor. So we want to reassure everyone that we're doing everything we can to take care of patients that have COVID-19 or are at risk for getting this infection. So our goal is to make sure that you know that we're working extra hours just to make sure everyone is taken care of.
Absolutely. Everyone has been going above and beyond during this pandemic. And you mentioned the severity of COVID-19. People with underlying health conditions, doctor, people who are of older age are likely to contract this infection more so than the younger people in our nation. What can you tell us about the symptoms that they are going to be experiencing more so than less?
So the patients that have underlying medical illness such as diabetes or heart disease or lung disease or even cancer, those patients come in sicker. And by that I mean their shortness of breath is by far more severe in that population than you would see with someone who has milder symptoms. So the breathing is way more concerning. Sometimes those patients might need to get intubated or have a tube placed. Their fevers are pretty high, just really very fatigued. They're very concerning to us when they come to the emergency room in that condition.
We've heard stories that young children could have COVID-19 but maybe not experience the same type of symptoms that someone who is older would experience. Are they still carriers that could transmit this virus to someone who could be more susceptible to just being in an emergency because of it?
Absolutely. You know, they can be the vectors for it, and they go home to their families or their grandparents, and then they transmit this disease to them. But they usually do not present in the same way as the elderly with underlying medical conditions.
What can you tell us based on your education, Dr. Wilds, as to what we should be doing as a community right now? Should we be in panic mode and hoarding things like toilet paper and water? We do know that Walgreens and Target and other major retailers are staying open for our health concerns, but what would you recommend?
So, big message that I want to send out to everyone is, you know, don't panic, be informed. So by that I mean if you're sick, then you need to stay home. If you have any concern about your family members, older parents, grandparents, make sure you check on them, but encourage them to stay home so they are not at risk for becoming more severely ill. Also, if you have a cough, then you want to practice proper respiratory etiquette. You want to wash your hands with soap and water, and if you don't have access to that, then you use an alcohol-based hand sanitizer. I mean, we have to use a lot of common sense with this. That's the only way we're going to take care of each other, and also social distancing. So you don't want to be with the large crowds at this time because you really don't know who is sick.
Absolutely, Dr. Wilds. You're saying the social distancing, we're going to hit that high peak, and then hopefully by stepping away from one another for a while, that will level off and we can get control of this virus. Again, Dr. Wilds, an infectious disease specialist, thank you for taking time with us this afternoon.
Thank you.